Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How long does Opdivo prolong life and what's its success rate? Opdivo, nivolumab, is an immunotherapy used to treat a wide variety of cancer types. How long treatment with this monoclonal antibody prolongs or extends life depends on the type and stage of cancer it is used to treat. In some situations Opdivo will prolong life for longer when used in combination with other medications, while in others it is better used alone. In other types of cancer it provides no survival benefit over existing therapies, but patients may be more likely to respond to treatment with Opdivo than to treatment it was compared against. How long Opdivo prolongs life and how successful it is at treating patients with cancer is typically measured in clinical trials by looking at overall rates of patient survival, and duration of patient survival/response or progression-free survival. How successful Opdivo is as a treatment is also measured in clinical trials by looking at the number of patients who respond to the therapy with either complete or partial responses, which is known as the objective response rate, ORR. The table below outlines by cancer type how long Opdivo prolongs survival and how many patients respond to treatment according to the results of key clinical trials used to gain approval of this drug. Cancer type. Trial name. Survival rates and duration of survival. Percentage of people that had a complete or partial response to treatment. Objective response rate, ORR, melanoma. Completely resected stage IIIBC melanoma, CheckMate 76K. Outcomes. Opdivo reduced the risk of recurrence, new primary melanoma, or death by 58% compared to placebo, HR, 0.42, 95% C, 0.30 to 0.59, P less than 0.0001. At 1 year, the recurrence-free survival, RFS, rate was 89%, 95% C, 86 to 92, for Opdivo versus 79%, 95% C, 74 to 84, for placebo. 1-year RFS rates by stage for patients who received Opdivo were 93%, 95% C, 8,995, in stage IIB versus 84%, 95% C, 7,789, with placebo, and 84%, 95% C, 7,888, in stage IC versus 72%, 95% C, 6,280, with placebo. Melanoma, unresectable or metastatic. CheckMate 037. Ongoing response. Opdivo, 87%. Had ongoing responses ranging from 2.6 plus to 10 plus months. Opdivo, 1338 had ongoing responses of 6 months, median duration of overall survival. Opdivo, 15.7 months, 95% C, 12.9, 19.9, versus Dacarbazine or paclitaxel plus carboplatin, 14.4 months, 95% C, 11.7, 18.2, HR 0.95, 95.54% C, 0.73, 1.24, objective response rate. Opdivo, 317%, 95% C 235 to 408, versus Dacarbazine or paclitaxel plus carboplatin, 106%, 95% C 35 to 231. Melanoma, previously untreated. CheckMate 066. Overall survival rate. Opdivo, 72.9%, 95% C 65.5 to 78.9, versus Dacarbazine, 42.1%, 95% C 33.0 to 50.9, objective response rate. Opdivo, 40%, 95% C, 33.3 to 47.0, versus Dacarbazine, 13.9%, 95% C, 9.5 to 19.4. Melanoma, previously untreated, unresectable or metastatic. CheckMate 067. Median duration of overall survival. Opdivo plus Yervoy, 60+ months. Versus, Opdivo, 36.9 months. Versus, Yervoy, 19.9 months. Overall survival rate. Opdivo plus Yervoy, 52%, versus, Opdivo, 44%, versus, Yervoy, 26%, objective response rate. Opdivo plus Yervoy, 58%, versus, Opdivo, 45%, versus, Yervoy, 19%, melanoma, adjuvant treatment for completely resected stage IIIBC or stage 4 disease. CheckMate 238. Recurrence-free survival, minimum 4 years follow-up. Opdivo, 517%, 95% C 468 to 563, versus, Yervoy, 41.2%, 95% CI 36.4 to 45.9. Non-small cell lung cancer, metastatic with PD-L1 expression level of 1%, CheckMate 227. Median duration of overall survival. Opdivo plus Yervoy, 17.1 months, 95% C 15.0 to 20.1, versus, chemotherapy, 14.9 months, 95% C 12.7 to 16.7. Overall survival rate. Opdivo, 40% at 2 years. Versus, chemotherapy, 32.8%, non-small cell lung cancer, first-line treatment of metastatic or recurrent disease. CheckMateLA. Median duration of overall survival. Minimum 12.7 months follow-up. Opdivo plus Yervoy plus chemotherapy, 15.6 months. Versus, chemotherapy, 10.9 months, HR 0.66, 95% C, 0.550.80. Overall survival rate. Opdivo plus Yervoy plus chemotherapy, 63% at 1 year. Versus, chemotherapy, 47%, overall response rate. Opdivo plus Yervoy, 38%, 95% C 33 to 43, versus, chemotherapy, 25%, 95% C 21 to 30. Non-small cell lung cancer second-line treatment of metastatic disease. CheckMate 017, CheckMate 057. Overall survival rate. Minimum 3 years follow-up. Opdivo, 17%, 95% C 14 to 21, versus, Docetaxel, 8%, 95% C 6 to 11. Patients with liver metastasis also had improved overall survival rates when treated with Opdivo compared with Docetaxel. Non-small cell lung cancer, neoadjuvant treatment of resectable disease. CheckMate 816. Median event-free survival. Minimum 21 months follow-up. Opdivo plus platinum doublet chemotherapy, 31.6 months, 95% C 30.2 not reached, versus, platinum doublet chemotherapy, 20.8 months, 95% C 14.0 to 26.7, HR 0.63, 95% C 0.45, 0.87. Overall survival rate. Overall survival was not statistically significant between Opdivo plus platinum doublet chemotherapy recipients and patients who received platinum doublet chemotherapy alone. Malignant pleural mesothelioma. CheckMate 743. Median duration of overall survival. Opdivo plus Yervoy, 18.1 months, 95% C 16.8, 21.5, versus, chemotherapy, 14.1 months, 95% C 12.5, 16.2. Median progression-free survival. Opdivo plus Yervoy, 6.8 months, 95% C 5.6, 7.4, versus, chemotherapy, 7.2 months, 95% C 6.9, 8.1. Renal cell carcinoma, advanced. CheckMate 025. Median duration of overall survival. Opdivo, 25.8 months, 95% C 22.2 to 29.8, versus everolimus, 19.7 months, 95% C 17.6 to 22.1. Progression-free survival was also improved in the Opdivo group. Objective response rate. Opdivo, 23%, versus everolimus, 4%, renal cell carcinoma, previously untreated. CheckMate 214. Overall survival rate. Opdivo plus Yervoy, 75%, 95% C70-80, at 18 months. Versus, Sutent, sunitinib 60%, 95% C55-65. Median duration of overall survival. Opdivo plus Yervoy, not reached. Versus, Sutent, 26 months, p0.001. Progression-free survival. Opdivo plus Yervoy, 11.6 months. Versus, Sutent, 8.4, p equals 0.03, objective response rate. Opdivo plus Yervoy, 42%, versus, Sutent, sunitinib 27%, p 0.001. Renal cell carcinoma, advanced, previously untreated. CheckMate 9. Overall survival rate. Overall survival was not reached in either the Opdivo plus cabozantinib, cabozantinib, group or the Sutent group during the 18.1 months median follow-up period. Median duration of response. Opdivo plus cabozantinib, 20.2 months, 95% C17.3, not reached, versus, Sutent, 11.5 months, 95% C8.3, 18.4. Median progression-free survival. Opdivo plus cabozantinib, 16.6 months. Versus, Sutent, 8.3 months, p less than 0.0001, objective response rate. Opdivo plus cabozantinib, 55.7%, versus, Sutent 27.1%, p 0.0001. Classical Hodgkin lymphoma. CheckMate 205. Median duration of response. Opdivo, 16.6 months, 95% C 13.2 to 20.3. Median progression-free survival. Opdivo, 14.7 months, 95% C 11.3 to 18.5. Of the evaluable patients in the trial treated past conventional disease progression, 61% had stable or further reduced target tumor burdens. Objective response rate. Opdivo, 69% across all three treatment groups, 95% C63 to 75. Squamous cell carcinoma of the head and neck, recurrent or metastatic disease. CheckMate 141. Overall survival rate. Opdivo, 16.9% at 24 months. Versus, docetaxel, methotrexate or Erbitux, cetuximab, 6%. Overall survival benefit was not impacted by PD-L1 expression of human papillomavirus, HPV, status. Median duration of overall survival. Opdivo, 7.5 months, 95% C5.5, 9.1, at the interim analysis. Versus, docetaxel, methotrexate or Erbitux, cetuximab, 5.1 month, 95% C4.0, 6.0, objective response rates were similar between the two treatment groups. Urothelial carcinoma, locally advanced or metastatic disease. CheckMate 275. Median overall survival. Minimum 37 months follow-up. Opdivo, 8.6 months, 95% C6.1 to 11.3. Median progression-free survival. Opdivo, 1.9 months, 95% C1.9 to 2.3, objective response rate. Opdivo, 20.7%, 16.1 to 26.1. Urothelial carcinoma, adjuvant therapy in high-risk patients following surgery. CheckMate 274. Median disease-free survival. Intention to treat population. Opdivo, 20.8 months, 95% C 16.5 to 27.6, versus, placebo, 10.8 months, 95% C 8.3 to 13.9. PDL 11% population. Opdivo, not reached, 95% C 21.2 not estimable, versus, placebo, 8.4 months, 95% C 5.6 to 21.2. Unresectable or metastatic urothelial carcinoma, in combination with cisplatin and gemcitabine, CheckMate 901. Median overall survival. Opdivo plus cisplatin and gemcitabine followed by Opdivo monotherapy, 21.7 months versus 18.9 months with cisplatin/gemcitabine alone, 95% C 0.63 to 0.96, P equals 0.0171, objective response rate. Opdivo plus cisplatin plus gemcitabine, 57.6%, 95% C, 51.8 to 63.2, versus, cisplatin plus gemcitabine, 43.1%, 95% C, 37.5 to 48.9, colorectal cancer, microsatellite instability high or mismatched repair deficient metastatic disease. CheckMate 142. Proportion of responders with 12 months response duration. Opdivo, 82%, versus, Opdivo plus Yervoy, 77%, overall response rate. Minimum of 27.5 and 33.7 months follow-up, respectively. Opdivo, 60%, 95% C50, 69, versus, Opdivo plus Yervoy, 38%, 95% C27, 50. Hepatocellular carcinoma. CheckMate 040. Overall survival rate. Opdivo plus Yervoy every 3 weeks, 4 doses, then Opdivo every 2 weeks, Arm A, 61%, 95% C46 to 72, at 12 months and 48%, 95% C32 to 61, at 24 months. Medial duration of overall survival. Opdivo plus Yervoy every 3 weeks, 4 doses, then Opdivo every 2 weeks, Arm A, not reached in patients with complete or partial responses, 14.5 months, 95% C 8.4 to 29.6, in patients with stable disease and 8.3 months, 95% C 6.6 to 10.8, objective response rate. Opdivo plus Yervoy every 3 weeks, 4 doses, then Opdivo every 2 weeks, Arm A, 32%, 95% C20 to 47. Esophageal squamous cell cancer. Attraction 3. Median duration of overall survival. Opdivo, 10.9 months, 95% C 9.2 to 13.3, versus, docetaxel or paclitaxel, 8.4 months, 95% C 7.2 to 9.9. Median progression-free survival. Opdivo, 1.7 months, 95% C 1.5, 2.7, versus, docetaxel or paclitaxel, 3.4 months, 95% C 3.0, 4.2, overall response rate. Opdivo, 19.3%, 95% C 13.7, 26.0, versus, docetaxel or paclitaxel, 21.5%, 95% C 15.4, 28.8. Esophageal squamous cell cancer, first-line treatment of unresectable advanced or metastatic disease. CheckMate 648. Median duration of overall survival. All randomized patients. Opdivo plus cisplatin plus fluorouracil, 13.2 months, 95% C 11.1 to 15.7, versus, Opdivo plus Yervoy, 12.8 months, 95% C 11.3 to 15.5, versus, cisplatin plus fluorouracil, 10.7 months, 95% C 9.4 to 11.9. Median progression-free survival. There was no statistically significant difference in median progression-free survival among the groups when the results from all randomized patients were included. Overall response rate. All randomized patients. Opdivo plus cisplatin plus fluorouracil, 47.4%, 95% C 41.8 to 53.0, versus Opdivo plus Yervoy, 27.7%, 95% C 22.9 to 32.9, versus cisplatin plus fluorouracil, 26.9%, 95% C 22.1 to 32.0. Gastric cancer, previously untreated advanced or metastatic gastric cancer, gastroesophageal junction cancer and esophageal adenocarcinoma. CheckMate 649. Median duration of overall survival. Patients whose tumors expressed PD-L1 CPS5. Opdivo plus FOXO6, fluorouracil, leucovorin and oxaliplatin, or CAPOX, capecitabine and oxaliplatin, 14.4 months, 95% C 13.1, 16.2, versus FOXO6 or CAPOX, 11.1 months, 95% C 10.0, 12.1, P less than 0.0001. All randomized patients. Opdivo plus FOXO6 or CAPOX, 13.8 months, 95% C 12.6, 14.6, versus FOXO6 or CAPOX, 11.6 months, 95% C 10.9, 12.5, P equals 0.0002. Median progression-free survival. Patients whose tumors expressed PD-L1 CPS5. Opdivo plus FOXO6 or CAPOX, 7.7 months, 95% C 7.0, 9.2, versus FOXO6 or CAPOX, 6.0 months, 95% C 5.6, 6.9, P less than 0.0001. Overall response rate. Patients whose tumors expressed PD-L1 CPS5. Opdivo plus FOXO6 or CAPOX, 237, 50% 95% C 46, 55, versus FOXO6 or CAPOX, 138, 38% 95% C 34, 43. All randomized patients. Opdivo plus FOXO6 or CAPOX, 370, 47% 95% C 43, 50, versus FOXO6 or CAPOX, 293, 37% 95% C 34, 40. Gastric cancer, completely resected esophageal or gastroesophageal junction cancer. CheckMate 577. Median disease-free survival. Opdivo, 22.4 months, 95% C 16.6, 34.0, versus placebo, 11.0 months, 95% C 8.3, 14.3, P equals 0.0003. Related questions: what are monoclonal antibodies? How long does Opdivo take to work and how do you know if it's working? What is the difference between Opdivo and Keytruda? RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.